Let's talk a little bit about non-surgical options, because certainly those are important. I mean, again, I enjoy doing surgery, but not everybody's a candidate for surgery, or not everybody needs surgery. So if we look at non-surgical options for knee arthritis, a lot of them are pretty basic, and then some of them actually require, some help from myself when that comes to injections or medications. But if you look at the list here, simple things like diet and exercise, resting the joint that's inflamed, giving it some time to kind of calm down, are important. Sometimes a cane or a walker can be real valuable, especially if you have some instability or you're not stable on your feet, and that takes a little pressure off of some of the joints. Medications, we'll talk specifically about some medications here today. Steroids, glucosamine, and then we get to the injections down here called viscosupplementation or cortisone injections, which can be real valuable. And then we'll even talk about a little bit about bracing, because I think there is some use of bracing in arthritic, in arthritic knees, for instance. So again, rest. If you look at rest, you could talk about, bed rest, and that'd be pretty extreme, where you just, stay in bed. You don't get out of bed. You just rest all of your joints, and that's probably reserved for a patient that has multiple joints that are involved. We see that occasionally in a patient that has rheumatoid arthritis, where multiple joints get inflamed at one time. A little bit of bed rest, where you'd really just take the pressure off the joints, could be valuable. When it comes to just a specific joint, just limiting that joint, as far as resting the knee or resting the hip by taking some weight off, the use of a crutch or a walker or a cane, that also can be valuable, but sometimes it just doesn't do the trick. Weight loss, certainly a hot topic when it comes to the orthopedic, community and these days in the United States, but on average, we all carry a little bit more weight. Typically, when you talk about a joint, usually the joint sees a little bit more stress as you carry more weight. And as they say, it's about, for every pound of weight, it could be about 10 more pounds of stress on a joint. So certainly it does add up to wear and tear on our joints. Again, going back to just a balanced diet, staying healthy and staying active can be helpful when it comes to decreasing the amount of wear and tear that we're seeing in our joints. So how about exercises? Well, I get asked a lot of times, what exercises should I be doing, or what do you recommend doing? Should I not do anything? And I think the answer is that exercise is still good even for a pretty arthritic joint. The reason being is joint mobility and the motion that we have in our joints keeps the fluid in there, which keeps the joint lubricated and keeps it moving. In addition to that, it keeps the weight down, which is all, again, the kind of vicious cycle. If, the weight comes on and we're not moving as much, the joints see more stress. So if we look at stretching, it maintains our normal joint movement, increases your flexibility, and relieves stiffness. It's real common to see a real arthritic knee come into my office with a knee that doesn't straighten all the way or bend all the way. And again, I think that's because the pain prevents someone from continuing to use the knee appropriately, and they don't stretch, and the knee gets stiff. And then that just makes the post-operative protocol a little bit tougher for a patient. If you go into surgery with a stiff knee, sometimes coming out with a little bit of a stiff knee is common, and you just got to work a little bit harder to get over that stiffness. So stretching is real important. Weightlifting or strengthening exercises. Certainly when a knee is arthritic and not being used as well as it was, it gets weak. The muscles around the knee tend to shut down when you're having pain. So the quad muscles, which are the ones in the front of the leg, really get weak on patients that are having a lot of discomfort. And I tend to find that the muscles that are the weakest are those quadricep muscles. And again, when you go into surgery, if you have weak muscles, you're going to come out of surgery with weak muscles. And it just takes a little bit longer to strengthen those with therapy. But it can be done. But exercise is real important to keep the joints moving, keep them lubricated with the normal joint fluid. Now, can too much exercise be a problem? The answer is yes. Obviously, if you overdo it, it can actually inflame the knee and cause fluid to build up, and that can be a problem too, and that's where you go back to the rest. So it is a little bit of a fine line. I always tell patients, if it's hurting, obviously back off a little bit, but try to stay active as opposed to just doing no activity at all.